Welcome everyone to our webinar to be exploring a field scan of Indigenous foodways in healthcare. My name is Jennifer Reynolds. I'm one of the co-executive directors of Nourish, and our small team works across Turtle Island. I'm joined today by the one of the co-chairs of our Nourish Indigenous and Allies Advisory, and I'll pass the mic to Marissa in a moment. But I just wanted to start off with a warm welcome to acknowledge that I'm calling in from where I live on unceded Mi'kmaq territory on the east coast of Canada. And Nourish's mission, I think, it just feels like a real honor to be able to host this conversation as we have been building our network with Indigenous and settler allies across the country to be working to advance food for health in all its many dimensions. And specifically today, we're going to be hearing more about how the healthcare sector has such a powerful role to play in the decolonization of Indigenous food sovereignty. And Nourish's mandate is overall working to build a pathway forward to address the many pressures and inequities that exist from our current health system and food system, and how they are not really as well connected as we would hope and dream they could be going into the future. So I'm really excited for Jared and Fiona to be sharing the highlights of the many rich conversations they've had with leaders across Turtle Island over the past few months. And I don't want to keep you away from that information, so I'll pass it over to Marissa to continue the welcome from Nourish.
Thanks, Jen, and hi, everybody. My name is Marissa Alexander, she, they. I'm calling in today from the traditional and unceded territory of the Qwustenuxun, which is in northern BC. I'm, as Jen mentioned, one of the co-chairs of the Nourish Indigenous and Allies Advisory, and we get to work really closely with Nourish and a lot of folks, and I'm very, very fortunate to be able to do that. I also just want to note that I'm so thrilled to be able to hear from both Fiona and Qwustenuxun. We are all very privileged to be able to learn from them, and I've been able to learn from them for a long time now, and I'm so honored every single time I get to hear them speak. I also just want to acknowledge that a lot of us speaking today are on the west coast of Turtle Island, and it's beautiful out here. It's a little bit rainy, and we're thankful for the rain. We're thankful that there's no floods and no fires right now. We'll touch wood for that. So thank you for that. But yeah, just really wanting to ground us in that we're so thankful and so honored to be here. So thank you both, and I will pass it over to both of you, and thanks for being here.
Hi, Qwustenuxun for that. Yeah, sure. So like, who am I anyway? I like to say so. Siemna siya, siemna swalakwa, siemna swalmoch, enta swalmosne Qwustenuxun. Siem skook het Qwustenuxun mastimoch, hitzel lalamechen, het swalmoch allens, swalmoch lachen. Ohaitaka, siemna siya. Just really happy to have these opportunities to be able to learn from, work with, and help to provide Indigenous foods to Indigenous and individuals wherever we happen to find ourselves. So really happy to be here. Hey, well, I'll hand it over to Fiona.
Hi, Qwustenuxun. Thank you so much, Jen and Marissa, for starting us off in a good way. And what an honor it is to be collaborating with Nourish. And then I wish I could see all the lovely Nourish faces and all the people across the land. So just sending my falcha is welcome in Irish. And so just welcome. We're glad you're here today. My name is Fiona. I'm a white settler occupier of Irish ancestry, and I'm first generation to these lands. My family have benefited personally and professionally off Treaty 6 territory and the homelands of the Qwustenuxun people. And then I here live and occupy the unceded ancestral and stolen lands of the Qwustenuxun people of the Songhees and Esquimalt Nation. So I come to this work humbly as someone that's learning, and to be able to work alongside Qwustenuxun is a gift every day. But there are so many other folks that have been kind enough to help me learn and start to understand and see food in a more holistic but broad and rooted and grounded way. So I come to this work as someone that knows that food is medicine. It's medicine to me, and it has been all my life. And then trying to find work and projects and the passions that just really ground myself in that same important foundation of that idea that food is medicine to each and every one of us, but in different ways. And how do we explore that in a good way? So I'm saying hello and just can't wait to hear some questions at the end of the webinar and hear from folks. But of course, it's important to start us off in a good way and just realize that we've got, I guess, over 140 people. So I'm just thinking about how vast the lands are across these lands that folks are calling in from. And so wanting to acknowledge the many lands across these lands and the people of those lands and their distinct culture and the diversity of the culture. And again, when we think about food, land, culture, and the stewardship of these lands since time out of mind, we know that the food systems have been distinct and diverse. And we really got to know that in this project and learning about the foods that really are tied to people's hearts, their ways of knowing and being. And so we want to just acknowledge the differences, the similarities, but also just honoring each nation as their inherent rights and title to their land, their food systems. And of course, we're here talking about food, and as we go through, we will acknowledge the ongoing colonial violence that has impacted Indigenous food systems since time out of mind, or since settlers came to these lands. And so we just want to take a moment to think about, as the settler folks that are on the call, do we know whose Indigenous homelands we live on? And exploring the history of the lands that we live on, the food systems of those lands, and then also what has and continues to happen to impact Indigenous people's access and rights to their foods and food systems. So just taking that moment, and we've got this beautiful map here of all the people that we got to spend, just a bit of time with, but to learn so much about their immense work and passion in their work around getting Indigenous foods into their institutions, into their communities, and really grateful that each and every one of you could join us today.
Yeah, and just as we run off of all of these ideas, just really wanting to acknowledge all of these communities. Like we were able to work with 10 communities, but that each one of them is highly unique, even within very similar regions, but within the regulations that we have to try to navigate, and the direct changes to our food systems through colonization and the utilization of our land for new resources. Every one of these organizations, every one of these institutions have been working so hard to try to navigate what used to be the easiest aspect of it, our lives, which is how we ate. We ate on a lot on these lands for thousands and thousands of years without having to navigate regulations, having to navigate new food systems, and just really want to use this opportunity to really appreciate all the work that all of these communities are actively doing at home to resist and utilize their Indigenous foods. Because as I'm always referencing, when we go to hospitals and we have to change how we eat, it can be harder than the issue that's originally uh sends us to the hospital. You know, if we eat one way at home, like at home here on the West Coast, we eat a lot of like seafood. And if, there's a like elder who's used to having to eat that way their whole like life, they eat one way and then they head to the hospital for whatever the like reason is. Now they have to try to like adjust how they eat. And there's a whole other like world of like troubles that is just related to that gastrointestinal like change. So how do we help to like facilitate the creation of like a safe space in all of these like institutions? But yeah, hey, for sure. Oh, Hajka Fiona. And so today we really kind of want to walk through what we heard, but really how we like heard it, like highlighting the realities of these like institutions and what they walk through every like day to get indigenous like foods into indigenous like mouths. And that as I've like referenced and I will reference over and like he over, they're all unique. Every like province has its own wildlife regulations and its own health like regulations, and there's ones that even have like hospital like acts and like regulations that either like allow or like prohibit the use of these like foods. And so we had the like incredible opportunity of like engaging with all of these communities and really like hearing like from them, and from that we were able to really like draw out these like themes around what within all these unique experiences, what really like he ties them all into one, and how can we use the journey that we had to receive this information to help highlight how other institutions across Canada can utilize like indigenous foods, and how can we create a like uh uh call to action in the way like he forward to the rest of the either the health or the agriculture or the wildlife like regulators of Canada to like to help us like navigate. It isn't always about changing the regulation. It's about changing the viewpoint of the regulator to not look at it as a, a one-way route. Like we utilize ways in like indigenous communities to like ensure wildlife are looked after, to ensure we're doing things in a like healthy and like safe way. So we need to ensure that these regulations or these like regulators can recognize these other ways of like working within our like food systems as like we advance. And then we're going to try to leave some room for questions at the end, but there's all of this wonderful like information that we want to try to like share with everybody. So we're really going to try hard to leave that little bit of room for some questions. Hey, oh, hi, Tap. And just, I guess to really hammer it home in our community here, we're constantly recognizing the elders and ancestors and their wisdom and their work to hold on to what we have. As an example, everything in our community at home here on the West Coast, everything is handed down verbally. All of our like recipes, all of our harvesting, all of our like hunting, everything is handed down verbally for thousands of years. And our tribe specifically went from 25 like thousand like individuals in the early like 1800s to less than 300 individuals within 100 years. And so the overall like loss of this like information, and then the years of like residential schools and like Indian hospitals, like it's incredible that we held on what we held on to. And so really want to like use the room to like honor those like ancestors and like elders from across Canada who through great and tremendous like adversity held on to this information, held on to their recipes, held on to their ways of like walking on the land and harvesting and like hunting, and then held on to it and handed it through the generations to the incredible leaders we were able to work with across Canada who have this information, who are able to hold on to it, and who are able to then utilize this to try to challenge the regulators and to challenge these legislative authorities, so we can try to reintroduce and continue to utilize Indigenous foods, well into the future. So really just want to, raise our hands here on the West Coast and say, oh, hi tzapka to everybody. Really just honoring them and recognizing that without everybody that was able to help us with this report, we wouldn't have a report. We're just here to be the ones to transfer the knowledge that we heard from all of them. But what we're walking through here today is not ours. It is the property of all of these communities and all their ancestors and all of their elders who were able to hold on to this wonderful information. Hey, it's Apka.
And so we were invited to set the table and hold some space with 10 communities, leaders, institutions that were doing this work across the country. And it would always just be, you're like, how can we only do 10? It was still an immense gift and privilege. And so this map highlights some of the people that took time to sit with us. And, I think about, the farthest away, like Dana, Marshall, and Roxanne, way out in Happy Valley area, and the diversity of reflections across the country, but also the similarities, it was just so profound. And I know our first interview was Dr. Joseph LeBlanc, and I could listen to his interview over and over again. I think him and Kathy's interview was very similar. We just kind of set the table with a little bit, and then they just talked fully for an hour, and we just got to capture their wisdom. And it was a gift. I always think about doing work, and you're just like, oh my God, I get to listen to these people that have been resisting the systems and paving paths forward and doing this work in such a good way. And then we were with Charlotte and Kelsey in Saskatchewan and Jose in BC. And then of course, Laura Salmon up in the Yukon, who's been, someone that I've been like, she's doing it for so long. And I'm like, I don't even know how to do it. And I learned so much from folks. And then we had the honor and privilege last summer to head up to Haida Gwaii and spend 3 to 5 days with the team up there and really learn and see, and of course eat, which is always exciting. Eat the food and taste the food and see how it was received for the residents in the long-term care. And then, of course, to learn from Six Nations and Kelly Gordon and see their big picture strategic vision that they had. And I was blown away when they were like, yeah, we're going to try and work it all together. And I'm probably missing 1 or 2 people here. Oh gosh, Lillian and Reggie in the Cree area. Just there's so many quotes from our time with them that we've embedded within the report. And I just want to acknowledge that hopefully today, all of these amazing folks will receive the draft report. We'll send it to them. And we want to hear, we want edits, we want shifts, we want changes, because it was only an hour. And how can you share the wisdom of your work in an hour? So just holding that up. And always humbled, when I was thinking of listening to Kitty in Six Nations around corn and just really hearing how important corn is. Where here it's salmon and other foods. And so just really that idea of diversity and listening. We decided to highlight just 3 communities. How do you pick 3 out of all of these amazing? To write extensive deep dive stories to try and really make sure we're amplifying the work that folks are doing. And then of course, there's always just the powerful barriers that folks wanted to share with us, and they were pretty clear and they were pretty similar. And so we can talk about that. And then also the facilitators that helped amplify and shift this work. So we're going to go through that. And then we can't, of course, talk about this work without naming regulations. And so that's a bit about what is covered in the field scan. But it's hopefully this summer, folks will just provide their reflections and insights, and then we'll see where it goes. Because of course it's a draft. Nothing is set in stone.
Hey, HCM, you know, highlighting these three communities was obviously very hard. How do you choose three out of the hundreds and hundreds that we've had to like work with over the years? But really, in a lot of communities, a lot of Indigenous like food work, we often hear about the White Horse Hospital. It's one that is reiterated through and through about the work that's happening there. But how did they reach there, and what was the catalyst, right? How did it happen there where it's not happening in other like regions? And they had the incredible opportunity and like strength of the Lahik elders at the like time of the creation of this new hospital that really wanted to ensure that their like foodways were included. And so they, in their Lahik Hospital Act, were able to get, the utilization of Indigenous like foods, Lahik directly into the hospital. And it's been utilized there, for quite like some time. But even with the usage, like there, one thing we run into in this work is the acquisition of wild like meats, something that winds up happening over and over and over, is that we want to utilize wild game meats like elk or caribou or like deer or like salmon in all of these institutions, but adequately compensating your hunters is against regulatory expectations, right? If you're hiring hunters, if you're giving them like funds for like food, it really walks a line. And so it becomes difficult to ensure the adequate usage of these like foods. So a lot of these institutions, they turn to utilization of like either donations, like at like the like White Horse Hospital, and there are like other institutions like the like Qwustenuxun, which is utilizing like confiscated game through the wildlife conservation officers are then like transferring this like food over. But with the like White Horse Hospital, one thing that was interesting to me as we were doing the Lahik interview is that the like pressure on the hospital to utilize these like foods was heavy enough that they challenged the regulations, right? That that the Lahik Indigenous community wanted their foods represented in a way that allowed them to literally like write into their like hospital act about how to utilize these these foods. And that that's the like Indigenous like population across Canada is like 3 to like 5 like percent on like average, but in like the like Yukon it's dramatically higher. I think it was up near like uh, um mm, 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 40% or like higher. And so having that like Indigenous like representation really helps to put that like pressure on those like regulators. And then as we heard from Kathy Loon about the like Qwustenuxun Health Center, like the utilization of Indigenous like foods there. It was it was wonderful to hear her. She was really highlighting how they've changed the regulations there, and she just was reiterating that if we could review how they change their like regulations, we could utilize these like foods like all over. And you know, like through and through all of these, they're just everybody wants to like share so that everybody can have access, right? And the reality that there's no concern about hiding this information, right? When like just as we were referencing earlier when we talked to Haida, like they're utilizing like foods that are not regulatorily, you know, like approved, but they want, you know, to highlight that as a reality that occasionally to to do the right like thing, sometimes we have to kind of walk on the edge of the like rules, right? And it's really like he sounded like the like he Meno Yawen walked the rules enough that they even actually like he began to like change them. And just, you know, this quote from like uh Kathy Loon really like highlights why we're doing this work. It's such a connection. Like that you can watch uh, like Elder, and we also heard this from like Whitehorse, and also from like Haida, and also from like Kathy Loon, that when you're like serving non-Indigenous like foods, that the elders and the individuals in these hospitals, they won't eat everything. They'll eat just enough to survive. But when we serve Indigenous like foods, they will eat all of their food and request extra, and they will be eating enough to be healthy, even maybe eating too like much if they have the opportunity, just because we're eating what we're used to. It's like I like referenced earlier when, you know, like the elders used to eating one way their whole like life, and then they have to go into these like institutions. How do we ensure that we can keep their gastrointestinal health up and keep their like happiness and their like direct connection to the land and the community up while they're in there, so that while they're having to travel through whatever like health crisis they have, how do we like support them in like the best way, you know, that possible? Yeah. And I'll hand it over to Fiona for the last one. Hi, Chika.
Thanks, Sam. Yeah, just so much gratitude for our time with Kitty and Kelly. And I, there's so many quotes from Kitty around resisting the colonial structures. And so this was one of my biggest wishes for this work, is the removal of colonial and racist systems and barriers. And I can't underestimate how we've heard that from almost everyone. And Kitty spoke so strongly about how there's so much effort trying to work and move things forward, that sometimes then the work doesn't happen. And so just really acknowledging that the emotional exhaustion that comes from those layers. Six Nations, of course, is a very large community, one of the largest in Canada, and is on reserve. And so there's a different experience that they were trying to share with us. But what I really wanted to, we really kind of tried to dig in with their story, was their coordinated, collaborative approach, and looking at more of a systems approach. And like when I think about like collective purchasing, like, you know, all the different programs, health, education, all like buying food, but not collectively or collaboratively. And so they're starting to look at bridging and building those connections. And again, when you think about that, that's like part of this work in so many ways, is this idea of siloed thinking, or this is my job, my role. And so I was really like, I just was like, oh, Kelly, like just this vision of this collective collaborative approach. And so they kind of shared, and I know that this is an evolving, so nothing I'm sharing is set in stone. And of course, we haven't really looped back to them about where the project is at now. But they were looking at 4 different streams, like a produce stream, or a production stream, like food stream. Where are they? Who can provide food? So a list of local hunters, fishers, producers, farmers, foragers, and how and where are we accessing the food? So more of a coordinated approach. And then looking at how you distribute those foods. How do we transfer and distribute foods more effectively in a way that is community driven? And so they were developing a survey to connect with community, to understand, and also how do you embed food literacy and Indigenous knowledge systems within that? And then the third stream was like a consume, eat stream. And that's again, like looking and asking the community and all the different healthcare facilities, what do they need? What's happening? What's working? And then a waste stream. So reduce, reuse, recycle. But like looking at, I know that that's really big here on the West Coast is food recovery. And we know that industrial food system likes to throw things away that's actually still edible and nourishing. And so how do we look at reducing the waste? And I think that then goes back to the beginning. It's like a collective system and a collaborative system. But then I just loved when Kelly, she's like, we just need a building. We need a centered place that's coordinated where all food activity comes from, and then we could distribute, connect, but that one central place where all the activities could come from. So you think about across the country, we hear about food hubs and how important having one distribution. And again, themed throughout every single one of our conversations was Indigenous staff, having directed staff to do this work. And what many of them said, they were always doing this alongside the many other things that they had on their plates.
And so in reviewing what we like heard from all of these like institutions, there were four main like themes, and the the reality that in order to get access to any of these things, we need to ensure that the institution is ready to work in a culturally like safe way, right? We can't be working in like institution where individuals are wondering why we're doing this work, what is going on, why do we have to value these foods. No, we need to be entering to like institutions that are like ready and ready to advance this work and are looking to like make that like change because they understand the like necessity of these like foods. But like, and then access, like that accessing these foods isn't always just about how to access like the food. Like I was referencing earlier, there are ways like the Haida Gwaii system, they hire hunters, even though that's not technically legal. Like I said, they really like to walk the regulations, but that then they acquire the like hunted like meats, and then they have those like meats run through a licensed like he processor so that it's then usable. And that's happening in a few other like he institutions, but also accessing like recipes and like workers and like how do we connect. And like I really liked Kathy Loon in their like health center was highlighting that she likes to do an annual or like every 2 years they do a cooking um, contest. I think it was like cooking with uh cookums, and they have all of their like elders travel from around the like region to their like health like center, and they do a cooking like uh contest where they like highlight like the like best recipes and all this and that. And at the end of that like explanation, she like whispered, oh, and all the winning recipes, they need to let us use those recipes. And you're like, what a genius idea, right? Having the community like share recipes, having the like individuals within these, like institutions, like the like indigenous like visitors in these like it's like institutions, like choosing the recipes that they want to eat while they're there, and then utilizing them, like working with community in a collaborative and reciprocal way that allows the use of these recipes that a lot of institutions have trouble accessing, because these recipes aren't just recipes. As I was like referencing earlier, like some of these recipes have been held onto like the like embers of an old like fire. They hung on to them for generations in the hopes that one day we could relight that like fire, and utilizing these recipes and these like institutions is relighting it and accessing them. Like they don't always want to hand them away, so how do you create a way that it can be like he reciprocal and community like he 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 oriented, and then like other institutions are just directly connecting with like indigenous he food suppliers, or even as like we just heard, creating room to like acquire all of these like indigenous foods and distribute them so that they can be like approved in a like central like he facility, like the Yukon. They're producing the majority of these indigenous like meals in their one hospital, but then they're actually referring these like meals to their like subsidiary hospitals, and so that everybody has access, but only one institution has to actually do the like acquisition of all of these like foods. And so in the like report, there's all of this like information about how these institutions are accessing it, and then the like process of navigating the regulations. Like in order to have these like foods, you can't just walk into the institution with them. You kind of have to know how you're going to use them. How will they approve? How will we use our like systems to navigate the regulations and the like desires from the community, right? You can't jump into this process without knowing, without having a like roadmap, and without having a direct connection to the community to ask them like, how do they want to be represented, right? How do they want to connect with this like institution, and what can that institution like do to like facilitate that? So it's a lot about trying to ensure that when we have the access and when we are like safe within the community, then how do we go about utilizing these like foods? And like lastly, just with each like province is all absolutely like unique with their wildlife regulations and their health regulations and the like requirements around like food like safety and acquisition of food, and like HACCP, hazard analysis, critical control, like he, 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 plans. Like how can these institutions navigate these regulations? And what I've been realizing through all this work is that this like report, which highlights all of these like regulations, could be used with other like institutions to highlight. Like here on the West Coast, we've got regulations that are very like prohibitive around the utilization of like wild harvested like meats, but in other hospitals they're using these like meats, and they've got regulations that like allow it. So reading a like report like this could allow institutions here on the West Coast to really like view and like challenge their like regulators. Well, if other regulations are like allowing it, and this is how, why aren't we? So using this like the document as a way to challenge and highlight how other institutions across Canada are utilizing these like foods in the hopes of altering or changing or even like enhancing and like navigating these like regulations when we like encounter them. And something that we've heard time and time again is just how food is so frequently centered on like physical like safety, right? The as I was referencing earlier, HACCP, hazard and critical control analysis, and like food like safety are all about ensuring like infection prevention and like control, which is highly valuable. But what about the other aspects of how we eat? What about the like direct like emotional connection to what we're eating? What about that like way that like a food can remind us of when we were younger or when we were harvesting or how we hunted or how we lived? What about the like emotional connection to the like the healing when you're happy because you're used to what you're eating? It's not new, it's not awkward, it's just who you are. And that like feeling of being represented, right, of not always feeling like you're on the outside, and the like direct spiritual connection that we like heard from so many communities around ensuring that we're cooking with happy like feelings, and that we're harvesting with that like what we call here on the West Coast Qwustenuxun, that the like harvesting with like a good heart and good like intentions. Like, what about that aspect of how we, what about the like mental connection to, like as I was like referencing, like remembering the connection to our land, our like food system, which also connects us to our like language and our like cultural like techniques. When we eat, we can like remember that those old like teachings, like, oh, only harvest what you need, or like out here on the West Coast they say, oh, when the like he tide is out, the like he table is like set. How do we ensure all of those other aspects of how we eat are looked after and like upheld in this work, instead of just constantly focusing on, is the food like physically like safe? We also have to ask ourselves, is it like spiritually like safe? Like where I worked for years as the elders like chef here, and if those elders heard us arguing while we were working on the like food, they would refuse to eat it because they were worried about the anger leaking into the food and having a direct contamination on all the elders who were having to eat it. They would refuse to eat it because they didn't want to get sick, they would say. But they're not talking about like physical like sickness, they're talking about like spiritual like sickness. And how do we have the regulators, the institutions, everybody to recognize and acknowledge that like physical like food safety is only one like element of the whole? And how do we create ways and I don't want to use the word like regulations, but like techniques to ensure that we're utilizing all aspects of how we eat, not just only the like physical ones.
Haitka CM on that. I was just also thinking about environmental safety. Like when we think about climate change and we think about this idea of local eating, like, and I know many of the folks on the webinar really truly get this, but it's so, when people hear local food, they think local food from an agriculture, colonial agriculture. They don't think about Indigenous food systems. And so just acknowledging this idea of planetary health and planetary food is Indigenous food systems. And so there's that environmental benefit to all of us, and of course, Mother Earth, as we think about centering Indigenous foods and the many aspects of Indigenous foods into our work. Yeah, so just really wanted to highlight the many powerful moments where people were just naming the resistance that they're constantly up against. Like they're always resisting these policies, these regulations. And so what I tried to do is there's this model that few models with Dr. Kamara Jones and Jody Wilson-Raybould. And so I tried to like theme all the brilliant reflections in a way to help regulators, people, settlers that are new to this learning, staff. And I see a question about all the food distribution companies, when they start to like try to like ground them in what they need to hear and understand. And so I'm just going to ground ourselves in a few quotes that we heard from knowledge keepers, because I think what's really important is we want this report to start to transform and not just be, you know, words on a piece of paper, right? Like this idea of how can this report be the shift that folks need to be. And I think one of the most powerful, when we think around the strategies for organizing, for action, the acting, it was Kelsey when she's like, as a regulator, as an environmental health officer, I need to get out of the way. And it was so profound. And it's like, how did we, so we've decided to try and theme these to help folks to start to say, I think Joseph was the one that said it. He's like, we need more yes people. We need people that actually want to go, okay, I actually don't know because I'm still learning and I'm still trying to understand, but I know that my education, my worldview is getting in the way. And so this is really an invitation to name the ongoing colonial violence, the ongoing disruptions. There was a few really great examples under the truth idea of like, you know, good ideas. So then maybe an outside organization comes in to help, and then they're like, oh, actually the solutions are really hard. And so they change and shift the goal because they actually know that this actual work is going to take some effort and transformation. And so how do we really invite people to truth telling so that they can start to learn about their education? Like I think about my education as a dietitian, you know, I came out wanting to tell everyone about this diabetes diet, and it had no social political context to it. It didn't have the structural determinants of health within it. And so I just was like, eat salad or whatever I was recommending folks to eat. And I think about regulators, they're like, I'm protecting the food system. I'm protecting, it's about food safety. And they're missing intergeneral thousands of years of knowledge on how food was kept safe without refrigerators and all these things. And so how do we start to kind of realize that there's racism within our education, there's racism within our professions, and that we need to learn, oh, maybe I actually don't, I'm not seeing this fully and completely. And so that invitation to learn, and then how to translate that learning into understanding what your role could be. Is it getting out of the way, or is it being like, I could start to poke holes in some of the policies, or we could try something different, or we could write this policy together. This could be deep-rooted collaboration. And so really looking at those first two, like you need to learn and understand and have that truth telling before we start acting. Or if you want to act, you're doing it with Indigenous leadership, Indigenous guidance. And then you're starting to see that these systems and structures are doing what they were built to do, which is say no. And so how do we start to have those invitations to yes? And so Kitty shared with us in my classroom at the university, the first thing I tell students is Indigenous people have the answers. We've always had them. It is your job to come and find them. She also shared, we have to figure out access before we can get into introducing Indigenous food, but it's doable. And this was such a simple comment, but it was so profound. Obviously, it's doable because in every town you go to, there's Chinese or Italian food in every city. So it can be done. So we can flip that centering to Indigenous food systems. The big work is making people realize that the white paper is still out there, making people realize that there are boundaries placed upon us by these policies. And then finally, Joseph was saying, there's this continuous cycle around consultation, consult. They say things like, well, we move at the pace of trust. You're never going to get to do anything, because ultimately what that means is, do the decision makers, policy makers, environmental health officers, dietitians, whoever it is, do they trust you as an Indigenous person? That's what they mean. They don't mean when we trust them. They mean that when I trust that what you're telling me is actually needed, that's the biggest barrier we have. And so there was a lot of powerful truth telling within our engagements. And so we've tried to theme them through this model and as an invitation for people to learn, but also move to that action, because we need to start seeing an interruption and a disruptions to those regulations and those policies. And so in a way, I see a call to action or a policy document directly towards regulators that could be done in a very relational approach that's like an invitation to start to try and see things differently. Is this me too, CM? It is. Okay, so we're really still building this section because, of course, the people we've interviewed haven't seen the document. And so we really want to hear from folks. And so that will be over the summer. Folks will be able to engage with the material and really help us make sure that what we've tried to capture here feels integral to the work that they're doing and integral to who they are and their value systems. But we know that the way forward that was starting to come out is that we need a decolonized and an anti-racism structure and funding models. Many times folks were sharing about the colonial violence of funding structures and funding models, and how that at times they can also co-opt and shut down and actually harm the projects that they want to move forward. And one sharing was so profound. It's like this idea that we need training modules, we need cultural safety, we need all these things. And actually we just need gas, transportation, hunting and fishing supplies and materials. We just actually need the ability to get out on the land and time, if we could just get more time. And so that colonial pressure of working full time and then also trying to access foods. This needs to be Indigenous led, and this is time. And we had so many opportunities to see Indigenous led, but we also need staff. A lot of times it was one staff. And so really moving away from this idea of tokenism and providing good employment, having a liaison between the institutions and the hospitals, but also making sure there's Indigenous people in the kitchen and then also within the community that are organizing these aspects of foods through access and intake. We need to look at the broader access and protection of Indigenous food. A few communities talked about climate change and the fires and how that's really impacting food systems. And the idea that, the policy document, position paper, something that would invite the regulators to realize they're actually really stopping the wealth and health of communities. And so how can we think about this document or anything moving forward in using that collective network and collective voice, because there were so many similarities within the facilitators and the barriers. And then in doing this, are we having any relational accountability? Like, we're not doing anything without being in relationship with the land and the people of those lands. And then that there is a lot of work to be done around Indigenous specific anti-racism, cultural safety, and how do we really start to reflect on our education, our socialization, our upbringing as settlers on these lands, and how that informs the work we do. And should we be doing it? And should we be getting out of the way? And if we're going to be doing it, how do we start saying yes instead of no? And so we're on that opportunity now, really, where we're thinking about future explorations of what is next. And I think that's the kind of a great place to kind of exit into questions, because there's so much wisdom within the group that's attending here today. So I think we have one more slide, and then we're going to move into questions.
I think that's it, friend. Ohaitsaka, siemnasiya, ohaitsaka.
Yeah, and Golomia Mathaga, many thousand welcomes for being here. And yeah, we'll pass it to Jen for some questions.
Sure, I'm happy to be fielding some of the questions in the chat. Thank you so much, Jared and Fiona, for all those themes. And just to be clear, I didn't do that properly at the beginning. All of this work is going to culminate in a written report. And as Fiona has alluded, it's going to go through a period of feedback with those who were interviewed to get the latest, to make sure it's as tight and clear as possible. And we are really hoping this discussion and ongoing conversations that are happening around many of these issues get fed into the kind of the follow-up and possibilities for moving and advancing on this agenda on its many fronts. And I actually hope this report will be one of the things that you've named as what is needed, because I think there is a lot of the patterns and themes you've identified. There's some really clear audiences and networks that we can collectively bring this agenda to. So just to open up some of the questions here, I hate this part where I'm having to pick pick which one. I am really curious if you have any response or thinking about some of the bigger food service management companies and what you would see as their role in taking up some of this work and showing leadership.
I was actually just in the middle of trying to like
Oh,
reply
you
to
were
that.
typing an
But
answer.
yeah,
Oh,
no, but
okay, well,
that
whatever you'd like then.
no, just that the what I like see with a lot of that is that those large companies need to recognize that each community eats in its own unique way. And so I've been working with the Chartwells here to try to have them realize that just because we're all in like Indigenous does not like mean we all eat one way. And so trying to have them, it's like we obviously want them to work with us. We want to have us all working as one, but I think they have work to do first in the realization of the unique ways with which each community eats, and even within each community, each like household is like like we're all unique. And so trying to create a way that they can acquire Indigenous like products, but also as there was like another question here, acquiring Indigenous products and not over requiring them. Like you can acquire a product and highlight it and utilize it, but the over like production always results in the overutilization of an under created like resource. Like I was asked recently actually on another webinar about when will Indigenous communities like be able to reach the demand for Indigenous like foods that like Western like communities have on like Western foods. And I laughed, and the like the honest answer is that Western like foods have had 100 years of utilizing all the land here to create what we have now. So if we had 100 years to utilize all the land to be able to create what we want, then it would only be 100 years. So while we're on our way towards that, though, utilizing Indigenous Lahik suppliers that can supply enough without hurting the Lahik ecosystem. And so when working with like regulators, how do we get regulators to allow Indigenous like food producers to produce their food and not allow anybody to do it? How do we allow it to not become something that becomes capitalized on, right? How do we try to keep our like food as like eat medicine instead of a commodity? But yeah, so that's my answer for that one. Hi, Scott.
Okay, thank you so much. I'm just noticing we are at the hour, which is what we had asked for people to join. And if you have other commitments, we totally understand. This recording will be shared on our YouTube channel. So, but I do think we need to close to respect our presenters' time and everyone else's time to join us. But if you want to pose a question in the chat, I think you know, we'd be really interested to see what your questions are, and we'll do our best to sort of build that into the potentially the next steps, or making sure that the stories and the information shared tries to address some of these questions. Maybe we'll include some of them in the report. I think we're kind of open to seeing what emerges there. So I guess I just wanted to thank our presenters and for doing all this learning. It's been amazing to see how you've yeah, how you shared it with us has brought some new insights. And I think there's some nice comments too in the chat of some learning and unlearning, recognizing that, and also some people who are ready to disrupt. So I think that's kind of cool. So I'll just, if you want to have the final word, or Marissa, I don't know if you have anything you'd like to offer at the end. Just thank you to everybody. This has been a really lovely conversation, and as always, I think a lot of this ripples out and continues on, so we're really happy to stay connected and bring all of you together where we can as the Nourish Network to keep this good work going forward. So thank you very much.
Hi, Hajka. I guess if I have anything to add at the end, I would like to remind us all that this work can be overwhelming and there's a lot that we have to do, but we have to realize that up until now, up until very recently, we weren't even allowed to have these conversations. That it's hard to acknowledge, but we are really the first generation to have this opportunity. So of course there's lots of work to do, but instead of looking at it as something that's overwhelming, I like to look at it like you're the first one to the feast table, and you've got all these opportunities, all these options. So as opposed to worrying about it, let's just grab a plate and try to do what we can do while we're here. So that's all I've got for you. Hey, oh, hi tak. Hi tak.
Thank you. That's beautiful.